Welcome, everyone. My name's Cole Siefer. I'm one of the co-founders of MedMatrix, also head of marketing, patient education. I'm joined here today with Colin Dees, one of the awesome providers here at MedMatrix. Colin, welcome.
Thanks for having me, Cole. I'm excited to have a nice conversation today.
Yeah, these are always super fun. So today we're going to be talking about a little bit about men's health, specifically around hormones and men's health, some of the biggest misconceptions, some of the things that we do, patient stories, whatnot. For context, for those of you who don't know, MedMatrix, we're the largest and fastest growing integrative functional medicine practice in Maine and New Hampshire. We have a couple thousand patients, one of the largest integrative medical teams. So we do these podcasts a couple times a week to educate, to provide, valuable information around your health and how you can ultimately treat the root cause of issues, live longer, live stronger, all those great things. So, um, without further ado, Colin, do you want to give some background on kind of your experience with men's health, hormones, just your expertise in this area?
Yeah, I would say I definitely had an interest in endocrinology and hormonal health, fitness and wellness in general, from the time I was a teenager. But then once I entered PA school as well, learning a little bit about endocrinology, probably not as much as I wanted to. And then got out into the workforce, worked in a more conventional medical setting for about 2.5 years. And then I went to a conference in which I learned about bioidentical hormone replacement therapy. And that I was just blown away. I thought it was just such an amazing thing that we had access to, such a cool tool. And I fell in love with HRT and the science behind it all. So for the past 4 years, I've been treating patients, hundreds, if not thousands of patients at this point, for men's health related issues.
Gotcha. What was like exciting? What was special? What was different about specifically hormonal
Yeah.
health? And
Well,
what wasn't taught, like what was not taught to you? Because it doesn't sound like you really learned much of anything about this side of things and the tools available in conventional medical school. Is that right?
yeah, that's right. It was like in PA school, it was a lot of, here are these conditions, mostly genetic or mostly pretty rare things, and people are going to have to deal with these lifelong, and there's not a whole lot we can do about them, or pills and surgery kind of ideas behind them. With hormone replacement therapy, when I started learning about that, it was more of the case of people could improve their life, improve how they felt, experience optimal well-being, and just live more productively, more efficiently, and just take their life to the next level. I just thought it
Mhm.
was so cool. It's like leveling up as a person when you go from being kind of not having the best hormonal profile and bringing that up to a better place.
Yeah. So hormones, having optimal hormones can make, are you saying like can make a huge difference in someone's quality of life?
It's one of the biggest levers to pull. In if we're just talking about health in general, right? There's these different areas: nutrition and exercise and mental health, and hormones might be kind of its own piece. Hormones are one of the biggest pieces for sure, because they act on just everything in the body. They're chemical messengers that they go all over the body. They affect every body system, and so it's just wide ranging benefits.
Okay. Can you explain to me like how hormones actually affect different, just the way we feel, our energy, our ability to lose weight, muscle, sleep? How do you mentioned like messengers? Like how does that work?
Well, yeah, I mean these hormones, like let's take testosterone for example. It's a chemical messenger. So testosterone has you have various androgen receptors all over your body. Androgen receptors in your muscles, androgen receptors in your prostate, in your brain. And when testosterone binds to these receptors, something happens. It's like a key going into a lock. Something gets unlocked, and that starts a process. So in the muscles, for example, testosterone can create anabolism, growth of muscle. In the brain, testosterone can help with certain neurochemicals like dopamine. So it depends on where it goes in the body, but this could be things like muscle growth, improved cognition, more energy, better sex drive. These are just some of the ones mainly relating to testosterone.
Gotcha. So when there is inadequate level of these hormones in your body, it's it's more of that these specific processes that make you feel good, right? Dopamine, motivation, or building muscle, they're not getting turned on. Is that right?
Yeah, exactly. They're not getting turned on, or they're getting turned on to a much lower extent.
Gotcha. How do you know that? Like, what are early signs that if you could just explain andropause too with this answer, like what are some early signs, and then what is andropause as far as early signs being like hormonal deficiencies or imbalances are an actual issue.
Yeah, definitely. So, the decline, some of these early signs, things that people are going to be experiencing if testosterone levels start dropping. Big ones are going to be just less energy in general. So, one that I hear a lot from patients is I get to the end of the day, I get home from work and I can't do anything. I just want to lay on the couch, sit there and do nothing. I can't go to the gym. I don't want to do anything extra. So it's kind of like your energy levels at baseline are just lower. The next thing is body fat gain, especially central body fat around the abdomen. A lot of men will start to notice that, it's just harder for me to lose fat and much easier for me to gain fat than it was 5 or 10 years ago. And then if guys are going to the gym, a lot of them won't have the motivation anymore to go to the gym. That's another big one. But if they are, they're having trouble putting on muscle in the way they were before. They are having trouble gaining strength the way they were before. And also, you will notice that men have less sex drive, and sometimes it can even impact erectile function and lead to erectile dysfunction. So, yeah, those are some of the big ones with low testosterone.
Gotcha. That makes sense. So, um, obviously, there's a lot of, especially now, ton of information out there. There's a lot of clinics even that'll kind of give anyone testosterone who comes through the door. So that's obviously not what we do. We do what's right for the patient. So when do you know that it's time to help someone out with testosterone replacement therapy versus when you can increase their testosterone without putting them on TRT? Like, for example, my testosterone levels went from I think it was like 500 to 1200 without any TRT, and I feel great. Noticed a big difference.
Mhm.
That was great. I didn't have to go on the actual replacement therapy. So how do you know when to put someone on TRT versus work on various pathways um, to change things to help get that up naturally?
Yeah, that's kind of where I think it's more of an art than if this then that kind of a scenario, because it really depends on the patient. So I'll give you some examples. Like if I start talking to a patient and I realize like they aren't going to change, or maybe not that they're not going to change, but they literally can't change. They work night shift, or they don't currently have access to the best food, and they literally are working 3 jobs. They can't exercise. So there's certain factors that are going to be really difficult for some people to change from a lifestyle standpoint. I'm not going to be super crazy about recommending all of these lifestyle changes at once. And then, Cole, we also have to be sort of realistic. And I say that because I have seen guys come in with borderline low or even low testosterone levels, and we do all of those things. We work on the sleep, we work on stress, we work on nutrition, exercise, lowering their body fat, and we still maybe only see a 200 or 300 point bump in testosterone, which is good, definitely better than it was before, but we don't get them into that optimal range. And some people just want to know that they're going to be optimal at all times, regardless of what life throws at them. Because let's say you are that guy and you're completely dialed in. Well, if you have a week where you go off the tracks a little bit, let's say you go out, you have a couple drinks, you're on vacation, you don't eat as well, or maybe you have a couple stressful weeks of work. Well, now your testosterone has dropped. Whereas with testosterone replacement therapy, you've got this sort of insurance policy to say, no matter what life throws at me, which life is going to throw a lot at us, and all of these insults from the environment, like chemicals and plastics and toxins and pesticides, all of these things that are basically unavoidable are no longer going to affect me or affect my testosterone levels if I'm on TRT. So you kind of have to feel it out with the patient and see where they're at. Are they ready to make the commitment? Are they ready to make a lot of lifestyle change? Or do they just want to have this assurance that at all times they're going to be optimal no matter what they do?
Okay. Gotcha. Um, so what are the so that makes a lot of sense as far as like explaining the lifestyle, like what lifestyle factors would kind of help you make a decision. But what about on the laboratory testing and demographics? So like what data would point you to say, hey, this is someone who should be on TRT versus this is someone we should use other various tools to move the needle without replacement therapy?
Yeah, I think that's a great question. Who would you put on TRT? Who wouldn't you put on TRT? I think a big one is age. So younger guys in general, usually that's guys below the age of 40. Some people might even argue a little bit younger than that now, just because I'm seeing personally as a clinician more and more younger guys coming in with low testosterone. I'm talking guys in their late 20s, early 30s. But in general, the idea is that before 40, you want to try as best as you can to avoid testosterone replacement therapy. I think it's sort of an arbitrary number in my opinion. I don't think anything magical is happening at age 40 that changes necessarily. I think it's just that by 40, most guys are probably almost done having children, or maybe considering that they're no longer going to have any more, or fertility is not as big of an issue because testosterone will affect sperm counts. So that's more so, I think what it is you have that conversation and you say, how important is fertility and building a family to you? How big of, or how long do you want to be on this testosterone medication? Because essentially once you start, you want to continue with it indefinitely. So you have to know that moving forward, you're going to be on this essentially forever. So that's more of, like I said, I don't necessarily think it's arbitrary number. It's more of a conversation to see where the patient is at.
Okay. And what do you say to patients who are like, I don't want to be on this forever? Is what's the conversation?
Well, sometimes I just reframe it and I say, well, okay, so you don't want to be on it forever. And then I'll say something like, well, are you going to brush your teeth twice a day forever? Are you going to eat 3 meals a day, forever? Are you going to try to go to the gym and take a shower? And don't you have these health habits that you're planning on doing forever? Because these
Mhm.
are things that you have to do to maintain your health. Taking a shower every day, brushing your teeth. These are things that we have to do. In the same way, it's kind of like you can talk about that with testosterone. This is just another health habit. Another health habit that you are going to try to incorporate so that you are guaranteed to have better quality of life and well-being. So that's one way to reframe it. The other way is that it's not necessarily a life sentence. If you do get on testosterone replacement therapy and if you've completely changed your mind, or your life has changed, or there's some sort of extenuating circumstance where you have to come off, there
Mhm.
are protocols and ways for us to get you off of testosterone. And then, the other thing is for guys maybe that don't want to be on testosterone indefinitely, there are some
Yep.
other modalities. For example, like enclomiphene. Enclomiphene can be used in a non-suppressive manner as an alternative to testosterone replacement therapy to bring up those testosterone levels.
Gotcha. Okay. So within conventional medicine, like we have a lot of patients. I hear it all the time from patients who I talk to is they go to the normal doctor and they're told that their testosterone levels are fine when they're, not essentially maybe optimal or contributing to them being their healthiest. Why is that?
Yeah, I think part of it has to do with the education around testosterone replacement therapy. When you go through medical school or PA school or NP school, whatever medical training you get, there's just not a lot of education around um, testosterone replacement therapy or hormone replacement therapy, hormone optimization in general. And so, with a lack of education, becomes more fear. If you don't know about something, and all you've ever been told is that, oh yeah, we got to stay away from that. Maybe it's not safe. Then you're just going to fear it, and you're not going to do it. So most practitioners just don't know how to do it, don't know that much about it,
Mhm.
because most of the education you have to get is sort of outside of what you would normally get in your medical training. And so, yeah, I think a big part of it is just lack of education.
Okay.
It's not, and also because it's just not a priority. Um, Having low testosterone, even though there's data that we could look at and say, okay, well, having low testosterone, for example, there's associations of low testosterone and higher rates of prostate cancer. So
Mhm.
that's interesting. But
Yeah.
most kind of doctors would argue, well, if you have sort of low normal testosterone, you're not going to die tomorrow. You're not going to have this major horrible event happen. So it's just not as much of a priority as some of these other issues might be.
Gotcha. Okay. That makes sense. So last thing with our last couple minutes here, I have for those who are listening to this, I have a screenshot of a health span versus lifespan graph pulled up. One where health is tracked on the y-axis and age is tracked on the x-axis, and you can kind of see the difference with or conventional medicine. It's a, a much faster decline, um, and then with functional medicine, we have a much higher quality of life for longer, and then it's a steeper decline at the end of life. What role does testosterone play in this difference between, um, the health span of a conventional patient versus a functional patient?
Yeah, and with testosterone in men, it plays such a huge role. Men are definitely easier than women, I will say, in that testosterone is such low hanging fruit because it affects nearly everything in a man's life. Not only from a sort of physical health perspective, but almost from a mental perspective, because men, when their testosterone is low and they know it, they just feel like less of a man. They have less drive to do the things they used to do, and that kind of messes with a man's head.
Mm.
And they don't have that sort of thing that makes a man, which is go out and conquer and adventure and build and do all these things. So that affects quality of life for sure. But testosterone, like I said, it affects insulin sensitivity, your body weight. It affects how motivated you are to go exercise and to have health habits. It can affect just various things indirectly, like your muscle growth. And so there's just so many systems as a man that testosterone is going to um, positively benefit, that it's really a no-brainer to for someone that's sort of suboptimal in that range to at least look into what functional medicine has to offer, because conventional medicine is going to basically say, well, you're normal, there's nothing we really need to do about it, whereas functional medicine is going to say, well, no, we can do better than normal. We can have you into more of an optimal range for better quality of life.
Mhm. Gotcha. Okay. So on the black line, it's like your testosterone slowly declines with time, or just hormones in general. They don't do anything. And this is obviously isolated to hormones in this example, right?
Mhm.
And then they don't do anything, but with functional medicine, they're able to keep it up, keep it up, keep it up based on what's optimal, not just based on you as an individual, right? Not just, oh, you're getting older. Is that right?
Yeah, yeah, exactly. It's not, it's like, okay, instead of you just saying, "Oh, well, I guess this is what has to happen with age. I'm just supposed to decline and not feel as good." You don't have to accept that. That doesn't have to be your reality. You can still be safe and physiologic, but instead of being all the way down at, a 2 out of 10, we put you at an 8 or a 9 out of 10. I think that's such a simple choice to make, but that's where functional medicine comes in and allows people to have that choice, whereas conventional medicine does not.
Awesome, Colin. Thanks for your time. I know you got to run. Really
Yep.
appreciate it. And yeah, we'll see you in the next one.
All right. Thanks a lot, Cole.